Action. This is Dr. Thomas Klein. I'm a specialist in rare and chronic diseases coming to you from Raleigh, North Carolina. Today we're going to follow up on our crisis of patients being cast to the curb by intervention from government officials. And that's a big topic, and I just want you to know that it's been a huge struggle finding other physicians to help out, see the patients. Doctors are drying up in the country. Pharmacies are drying up. There's been an attack on doctors and pharmacies because we are the purveyors of the evil opioids. And remember, every time you say opioid, say opioid pain prescriptions. But we want to talk today about it's time to act. A lot of people are asking me what we can do. But before we can do something, we need to understand the nature of the problem. We at JATH Educational Consortium believe that we're going to start from the point that everybody is correct. And then we're going to go from there. And what we found is everybody is correct, but it's the degree of which they are correct that's important. So we're going to start with a study that you can all find. It's in Newsweek magazine on October 22nd, 2019. It's called Study Finds Less Than 2% of Overdose Victims Had an Active Opioid Prescription. 2%. This is 2%. This is how many people overdosed on prescription opiates from pharmacies, from doctors. This is the number of people that overdosed in the street from fentanyl and heroin. Do addicts go and get pills? I just talked to one yesterday and he said no. People on the street who are treating themselves for their genetic type 2 addiction disease don't bother. They know they're going to get hassled at the pharmacies. They don't have enough money. They don't have insurance, so they don't bother. So this 2% actually are people with prescriptions like you and me who overdose. Overdose? Well, all that means is they died with prescription drugs. And in analyzing those tiny amounts, we're finding not that many really overdosed. They just had the drugs on board. Nobody looked into anything else. No autopsies. Now, the other fact that we found is that when I asked the question, how many people actually divert? You know, this is a problem. People take drugs and sell them, and they don't pay taxes. This is a problem. 1%. That's 1%. So how much are we going to hassle all these people who need pain prescriptions in order to address this 1%? How much do we as doctors and pharmacists have to do in terms of police work? If we have somebody who tricks us, which is very easy to do because these people are smart, they're making a lot of money, then we're held accountable. Where are the police? Aren't they accountable? Have we accepted the entire process of law enforcement for people who trick us? And if doctors get tricked by several people, guess what? They go to prison. Steve Henson, MD, Joel Smithers, MD, are currently in federal prison for sentences of life and 40 years because they failed to detect hustlers. So then they got charged with prescribing outside of normal limits because these people didn't have a disease, but they were tricksters, con artists. And we're held responsible. Same thing with pharmacists. They're held responsible. Somebody slips through the net. The problem is very small. Oops. The problem is very small. So we need to start putting things in perspective. Yes, there are hustlers. How many people trick pharmacists and doctors who are addicts? None. They don't bother. Now, where did all this get started? All this stuff that we're seeing about drug testing and, pain contracts, pill counts, where did this come from? Came from the CDC. And the CDC, which we're going to get to in a second, basically is operating on no scientific evidence, and they admit it. What they operated on were experts. And guess where half the experts came from? PROP. The PROP CDC alliance is the only thing that's driving all this. There's nothing else driving this, just these two organizations. And currently, the president of PROP, Dr. Jane Ballantyne, has made public statements that, we're going to discuss that in more detail next, but she's made public statements that people with chronic long-term disease don't need opiates because they're just going to become addicted. And are you ready for this? She said that when people come off their pain medicines for a chronic disease, it makes their pain worse. This is the president of PROP who went over to CDC. Half of the CDC experts, or about half, are from PROP themselves, an organization that does not believe in the treatment of opiates and said so publicly. So now we got to go to the CDC guideline, and in the very first sentence of the CDC guideline, this is what it says. And what it says is, this guideline provides recommendations, blah, 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 outside of active cancer treatment, palliative care, and end of life. Palliative care and end of life. Those are two different things. That's hospice and palliative care. There's a lot of confusion about palliative care, and this is the definition from CDC. I'll just read it to you. For this guideline, palliative care is defined in a manner consistent with that of the Institute of Medicine as care that provides relief from pain and other symptoms, supports the quality of life, and is focused on patients with serious advanced disease. Everybody out there, all 10 million of you with terrible, horrible, rare, and painful diseases, if you can't cure it, then it's palliative care. Palliative care means that if you give a treatment, could be vomiting, could be respiratory difficulties, could be diarrhea. If you can treat the symptom and you cannot treat the underlying disorder, all of you are palliative care by the CDC definition. So we need to start pushing this. And if you Google Thomas Klein, MD, PhD, you'll go to all my writings, and there's some writings in there about palliative care, which is being totally ignored. Now, the next most important thing is all this business about pill counts, urine tests. The question is, and I've been criticized because I don't do urine tests because I found them not to be accurate, and I have a better system. But that's floating around right now. Even a pharmacist mentioned it to me. It's like they already know what's going on at the board, the pill counts. So here's the CDC. The accuracy of risk mitigation, that's all these things to prevent. Who are they trying to prevent? Dope fiends, overdoses, it's not clear. They never really make it clear. They talk about overdoses and assume everybody will think that means addiction, which is not true. Okay. Strategies including pain contracts, urine drug tests, the PDMP, which we talked about, which is the Brandeis spy network, monitoring formulations, blah, blah, blah. It says there's no evidence of benefits or harms from these things. So then they go on and say, well, but our experts say, so you know what? Because they don't have any scientific evidence, the experts wrote the CDC. And here are the experts from this organization. So it's time that we start to have some investigations into how this happened. If they say there's no evidence, then there's no evidence. No evidence of pain contracts being effective. And then it says, guess what we're recommending? They recommend all these things after they've said that they don't have any evidence they work. Okay, that's what we do at JATH. We're trying to get at the basics. We're going to talk about acting next time. We have to go so that I don't have to split this video, which took me an hour last time. And we will catch you later. Thank you.